So the COVID infection now is sort of pan-India. It has gone to smaller cities and it's also gone to some parts of rural India. And the numbers therefore have continued to increase. This is to some extent expected because as we move ahead from it being localized to large metro cities where the infection first came in from abroad, it has now spread to other parts of the country. And considering the population that we have, and the vast distribution of this population, the number of cases will rise to some extent before they flatten out. We will have a huge number of cases. It's only that if you were to look at the number of cases per million population, that you could say that our numbers are not that much. But in absolute numbers, we will actually have a huge number of cases.
Of course, the good news is recovery rates are also increasing at the moment, and that's the positive news that's coming in, Dr. Guleria. So at one level, of course, the COVID curve is not flattening, but if you look at the recovery numbers in this country are rising at the moment as well. So that's the good news. Just linked to that, are parts of India, Dr. Guleria, as some suggest, seeing a second wave? You know, Delhi, for example, now is seeing 2,000 cases a day. Earlier, it was really dropping. Are we seeing a second wave?
Yes, so we are seeing a resurgence of cases. We could say that we are seeing some sort of a second wave in certain parts of the country. And I think there are multiple factors for that. One factor is that, of course, our testing has gone up dramatically. We're doing more than 1 million tests per day. And in areas where we test more, we will definitely pick up more cases. But I think a more important factor is that we've, as a population, gone into what I would say is a COVID behavior fatigue. That a lot of us who were very strict or very compliant in terms of the COVID appropriate behavior when we had the initial lockdown have sort of reached a situation where we have had fatigue, where many people have just said enough is enough. And if you now go out, you will notice that even in Delhi, people are not wearing masks, people are still crowding together. They are still there. We are back to the traffic jams that we were seeing in the pre-COVID era. And all of this is promoting increased resurgence of infection, because remember, the serosurveillance did show that almost 70% of our population is still susceptible. So this will actually drive the number of cases.
Interesting, COVID behavior fatigue, and I'll come back to that in a moment. But the other question that comes from that is, will the pandemic therefore continue into 2021? Is it now certain that this is not going to end only this year, sir?
Yes, I don't think that we could say that the pandemic will finish this year. What we could say is that we will be able to keep the curve on a flatter side rather than rising very steeply by our interventions, so that we don't have an overwhelming of our healthcare facilities, or we don't start running out of beds. But the number of cases will continue like this or for some more time. We may see a gradual drip, but that will take a few months before we can say that we're really past the pandemic. So early next year is something that we are looking at.
At the earliest, you're saying next year, early next year. How soon is a vaccine expected is our next question, Dr. Guleria. Today, the Lancet has revealed that Russia has been rather successful with their Sputnik vaccine in terms of ensuring that antibodies are developed in the human trials. They seem to be ahead of the race. The US president says before November 3rd, the US presidential elections, we could have a vaccine. How is the vaccine in India doing? How soon do you expect actually a vaccine anywhere in the world? Because World Health Organization says not before mid-2021.
So when we're looking at the vaccine race, it's a large number of companies, including 3 from India, are actually in quite an advanced stage. But having said that, I think the most important issue for any vaccine is that it has to be safe. And even if you look at the paper which is published in Lancet today, the sample size is small. They've done it in a small number of volunteers and shown that it does is safe in them. There were some minor side effects like a local reaction, some febrile reaction, and there was good immunogenic response. But this is a very small number. You need to do a trial in a larger number, which is the phase 3 trial, before you can really say that now we have a vaccine which is safe. It will be a huge disadvantage to the program if you start a vaccine early and then you land up later on with significant side effects.
Right.
So I do agree that it's going to take a few months, but there is a huge effort to sort of compress everything in term and also the manufacturing part. So hopefully, if everything goes all right by the end of the year, but trials do have ups and downs. So we'll have to see how things evolve as far as the vaccine is concerned.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.